look at where progress has been made. So we know that the provider workforce shortage in the delivery of health is a complex issue and remains to be fully resolved. The workforce shortage has adversely impacted Hawaii for decades. And I recall our first workforce summit in 2010. At that meeting, we systematically looked at multiple issues impacting our health workforce: the provider supply, demand, and also the support and retention efforts that were underway for our providers. In 2010, we concluded that there would be no one single action which could address the entirety of our provider workforce shortage. But we also indicated that we could not put this on one segment of our economy to solely be responsible for meeting this challenge. It was one we truly had to do together. And so today, as before, we bring some of the best minds in Hawaii together to talk about potential solutions and things we can do to improve our current situation. But I think we really should take a moment to also pause and think about when the pandemic hit us in Hawaii in 2020. Many of us were concerned that the Hawaii healthcare system might not survive that pandemic, that we would implode because of our already limited workforce. We're fortunate to have dodged that bullet. Indeed, our healthcare systems, private providers, the Department of Health, and our health science educational programs contributed to perhaps the best per capita COVID response and clinical outcomes for any state in the nation. And I think we should pause a moment and just reflect upon how much was given during the COVID pandemic for us to be where we are today. Our healthcare providers gave much of themselves. Yet coming out of the pandemic, our providers are weary of the long hours and the practice adjustments that needed to be made. A number have left practice in Hawaii or are considering leaving practice. These providers continue to face the same challenges that we've identified previously before the pandemic. For example, insufficient reimbursement, high practice costs, significant practice administrative burdens, high educational and other living costs for the family, relative isolation from practice colleagues when in rural and neighbor island settings, and the burden of educational debt for those who are coming out of training. With support from our community providers, the governor, the Hawaii legislature, and private donors, the medical school has been chipping away at the workforce shortage, often in partnership with other health science colleagues and organizations. We've begun to address some student-focused programs, providing pathways into the health professions. And of course, our Hawaii and Pacific Island area health education centers, who were some of the coordinators and the work effort behind this meeting, are a big part of that. But there are other pathways we've begun to develop and our health science colleagues have done in other professions. We've also collectively worked on an educational loan repayment program, which has brought providers into high need areas of the state and also helped unload a lot of their educational debt. And we have one of the best retention rates in the country for those who've taken part in our educational loan program. We also implemented a few years back a preceptor tax credit for providers to help spend a little time in their practice to precept our students, nursing, medicine, and other disciplines needing that physician and nurse practitioner oversight. And we're very pleased to have that recognition that was put forward by the legislature. We've also been able to expand programs to address rural training needs, and also in case of the medical school, where I have the most direct impact, been able to work for addressing financial aid for medical students. So let me highlight just briefly the effort of our medical school to lower student debt. As you're aware, educational debt can be a major barrier to a student choosing a primary care discipline, practicing in our state with the higher cost of living and practice, or even choosing to practice on a neighbor island or in a rural setting. So looking at the latest numbers from our graduates of just this year, 2022, reported by the Liaison Committee on Medical Education, more than 40% of JABSOM graduates completed school with zero medical education debt, compared to only 29% of students nationally. This year, the median scholarship amount that our students received during their education came to $80,000 of scholarship support versus only $30,000 of scholarship support on average elsewhere in the nation. Upon graduation, 46% of our students are planning to work in underserved areas, compared to less than 30% in other parts of the US. I believe that with a combination of public and private support, we can provide all of our students a full ride scholarship. But not just the financial support, we believe there should be a commitment to practice year for year of the support here in our state for those who are so fortunate. And we have implemented that program at the medical school where we're able to provide that extensive support. So we think that is one small element and will have an impact on our physician workforce, but we have other disciplines, other professions that have significant challenges as well. And I have yet to raise the money to do that for all of our students. So it is a goal, an aspiration. But obviously there are other opportunities for investment that will have an impact and which we need to address, because it's not just enough to train. We have to be able to retain our practitioners. So I'm very excited about the work that we will collectively do today. I'm excited that you're here and you're committed to this effort because you have insights that no one of us have. We have to collectively do this. So our goal, of course, is to ensure the availability of needed healthcare professionals for the future of Hawaii. And only by doing so can we ensure that Hawaii has access to the healthcare that is needed. So mahalo for helping with this task. I'm going to transition here because it's my great honor to bring up our Lieutenant Governor, Josh Green. Josh Green, as a practicing physician, has made an impact on the health of people on Hawaii Island through his direct practice, but also, more importantly, through his clinical efforts at administration. He's had a significant impact on the state's success during the COVID pandemic. And to address the workforce, he has been a consistent partner in this effort. And I'm so thrilled that Josh is here. Let's give him a big round of applause.
Aloha, everyone. First, let's give again some appreciation for Dean Hedges, who's been our fearless leader for so many years at JABSOM. He's been fantastic. Dean's been here with us side by side, fighting for healthcare access since the beginning, as he recognized that we started this in 2010, this group. I also want to recognize Kelly Withy, Dr. Withy. She's always been our champion to get this together. So many good friends. Dr. B. Lum is, I don't know if I've seen her yet today, but we have champions amongst champions, and so I'm grateful to be here with you. I will say this. As a somewhat chubby Polish doctor from the mainland, it gave me great pleasure to see the yogi pulled off of the stage by Kelly Withy in order to give us time to have Dean Hedges speak today. Also, as you can tell, these are opportunities for us to get together and do more than just healthcare policy. We sit next to our dear friend, Nadine Tensala, who we were able, Jamie and I, she's our PCP. I was able to get a referral both for my Achilles and for Jamie's contraception. So this was terrific. So, sorry, honey. But you know, healthcare is a very dynamic thing here at the table at our workforce meeting. So I get the opportunity to do all kinds of things with you today very briefly. First and foremost, I want to recognize our sponsors. Department of Health, Alcohol and Drug Abuse Division, the Office of Primary Care and Rural Health Association, JABSOM Department of Geriatrics and AHEC, United Healthcare, Papa Ola Lukahi, Aloha Care, Hawaii Pacific Health, Westpac Health Partners, and Chaminade School of Nursing, and not least of all, HMSA, who recently gave $5 million to JABSOM. Let's give them all an amazing round of applause for what they did. So I'm grateful just to be with you as a doctor. Been working in the ER for many years, 25 years now, as an emergency room physician and as a primary care physician in family medicine. And I know what you've gone through. I know that the struggles are many for us to stay in practice, to bring new young family members into practice in some cases, or to recruit our kids back after they've gone to our great public schools or to Punahou or Iolani or Midpac and come back into practice. And that's what we all have to do. That's one of the many things that, in addition to our efforts today, I think we have to strategically reach out to those kids that we've always known to be extremely intelligent and wonderful, but may have reason to otherwise drift to the mainland. And so Dean has been great with that. And I'm really enthusiastic about, if I continue to serve, being in many ways your recruiter in chief to bring healthcare providers back, whether they're social workers, thank you guys, to family doctors, to nurses, PAs, all across our spectrum. So that is important. I think that we always exercise our own capacity because we have all of these connections. The coconut wireless can drift very far to bring people back into healthcare in Hawaii. I also want to say a couple other things before I talk about some of the more perhaps mundane parts of the conference, because Kelly did tell me to inform you that the bathrooms are where they've always been for the last 10 years. That we will have 25 raffle prizes. You have to be here in person though. So if you try to skip out on this conference, you're not getting anything. That'll be at 3:15 and 5 o'clock. Whoever wins the big prize will be my lieutenant governor starting in 3 months. Sorry, Sylvia, that's not true. And finally, that the sessions are in your flyers. We ask you throughout the day to vote for your 5 priorities because it's very important. That will be incorporated deeply into policy going forward. And you'll always have my ear if I'm able to continue to serve. But I just wanted to say very briefly, one other thing that I feel strongly about health policy, and I think that we should continue to be focused on, and that's the disparities in healthcare for those who struggle. They are socioeconomic, they are race-based. For Native Hawaiians, like my extended family, if you're a Native Hawaiian, you develop chronic disease 10 years earlier than most of the other populations in our state. You're likely to die 8 years earlier. And we've known that because of the extraordinary epidemiology and the clinical work that you have done. But these are things that must be resolved. And I think it's incumbent upon us, not just out of a sense of good healthcare, but a sense of justice, that if we can really address those issues as we go forward. So please know in your hearts that I will be fighting on those issues amongst many others with you. I hope that you win raffle prizes today. I hope that you find the bathroom safely. But most importantly, I hope that you enjoy this next speaker. And I'd like to introduce my dearest friend, former boss, Dr. Nadine Tensala, who is just one of our greatest assets in healthcare in the state of Hawaii. She's a dream come true, a great PCP, and thank you for everything you've done, Nadine. I think it's time for me to call you up here. Thank you, guys.